And I think by this time you are already knowing the skeletal topography of the thorax. And now you will see in the lab, previous to the, I will just tell you. Now, what are the probable questions according to the competency based? Now, you see, write a short note on histology of trachea. So, short note might be of 5 marks, 10 marks for slides, identification. Khata and everything, 20 marks. So, be very calculative and be focused and examination oriented. Because medical science, you have to acquire knowledge as you go. Because of when you go to your clinics, you again just go through your gross anatomy, histology. You just keep on adding on it, value added. Okay, now repetition, everything will be repeated. Now, trachea is a cartilaginous tube that acts as the air passage from larynx to lungs. This is the larynx. You can see this part. It is a ring structure, the cartilages. Now, this is very important because of performing emergency tracheostomy. Putting a tube in emergency cases, and now length is 10 centimeters, diameter 2.5 centimeters outer and 1.5 to 2 centimeters inner diameter. The trachea divides into main primary bronchi. The lumen of the trachea is non-collapsible, remains open due to cartilages. So it does not collapse. Okay, because it is having a cartilage. Now, the unique feature of trachea, presence of C-shaped hyaline cartilage. C-shaped hyaline cartilage anteriorly, and posteriorly there is a muscle, and then posterior to the trachea is the vertebral column. Okay. Now, histology of trachea, the wall of the trachea shows mucosa, submucosa, cartilage muscular layer and adventitia. Now, what is the function of the trachea? You breathe, inhale, it goes through and goes through to the lungs. So, now it has to, the epithelial cells, the mucosa and submucosa, and the epithelial cells of the mucosa, cartilaginous muscular layer and muscular layer, adventitia. Now, histology of trachea, mucosa. The trachea is lined by ciliated, pseudostratified columnar epithelium. Question in NEET, identification features. Now, ciliated columnar pseudostratified columnar epithelium, ciliated. Ciliated means you will just go on, the cilia will move, and accordingly they perform their duty from preventing how much they can at a blunt like Delhi's pollution, smog, smoke, that it will of course keep on acting. And you have any now cells of the tracheal epithelium. Tracheal epithelium shows the following: ciliated columnar cell, mucous cell, brush cells, small granule cells and basal cells. Now, ciliated columnar epithelium, The stratification is a different thing. You know the pseudostratified epithelium character, already you are knowing, you are having the knowledge, but I am just repeating it to you. Now, in the mucous cells, brush cells, the mucous cells will secrete mucus in between the mucous cells. It will secrete mucus. So, if like you ask any person who is having a cough and cold or something like that, you say, "Apnar cough hai, do you have this thing that something is coming out?" Or you ask, "Is it watery, or it is yellow color, or dryness of the throat or something like that?" Then you you just, when you spit out, do you or you throw out your cough, then does it have blood stained or frank blood? Now, these are the things you have to ask during your examination of the patient. Now, because you will get clues, but if it is like just specks of blood with this mucus or something like mucus, then it might be from the pharyngeal wall and this thing, and that is a rupture of small vessels or something like that. It can be that she is having a temperature, and then you auscultate the lungs. There is some crepitations, rhonchi. These are the words you'll be knowing. Then that patient is having some infection. It might be now the infection will give you different types of clinical presentation, and also sputum. You have to, if he's, then you goes for like frank blood from the lung, then you go for a sputum examination 3 consecutive days for acid fast bacillus, that is for tuberculosis, or it might be frank blood hemoptysis. I told you the other day, hematemesis and hemoptysis. Now, hematemesis is coffee ground color. The blood mixes with the stomach acid, then it gives you a coffee ground color. But in hemoptysis, it is frank blood. And a patient comes with a acute gastric hemorrhage, hematemesis, then there is chance of saving that person is great. But at present, you are having a blood bank, you are having emergency services, then you accordingly have to manage. Next, when you go to your clinics, you will be knowing, but you just try to correlate the simple anatomical pathway of the respiratory system. Okay? Now, this is the brush cells, small granules, basal cells. Now, mucosa, basement membrane, as you know, this is the the basic this thing classes we took on epithelial tissue, basement membrane, the whole this thing, like you see the buildings of the medical college. You say you have a typical this thing, the way they are building up a building. That is, see, they to make the foundation, then column structures, brickwork, glass frame, and that block is made. Similarly, you see your skeletal thoracic cage, the bones, this thing. Now you come to the trachea, the lung, and how the actually anatomy is such, how this is like I told you the trachea itself, anteriorly it is cartilaginous, C-shaped. Now posteriorly nature is such that it could have been a tube, total tube. It could have been, but the nature is there for there's a small muscle. C-shaped, the other thing is muscles. Now that is to the mobility. And now submucosa on HNEC is difficult to distinguish demarcation between lamina propria and submucosa. HNEC you cannot distinguish. Submucosa contains mucous acini with serous demulcens and ducts of these glands lined by cuboidal epithelium. Now submucosa, serous demulcens and ducts of these glands lined by cuboidal epithelium. Submucosa also combines lymphatic follicles, blood vessels and lymphatics. Tracheal cartilage and trachealis muscle. This trachealis muscle, trachea contains 16 to 20 C-shaped hyaline cartilage rings. Identification features. This is a trachealis muscle and this is the C-shaped cartilage. Okay? This is anterior, this is posterior. These are tracheal rings. So, the short note I told you, every organ expect a short note. Every histology there will be one 5-mark short note. Patch of char le lo. Histology lab 5 slides, 2 marks per slides. That is 10. You 8. Now, if anyone says shh, kidney, shh, trachea, or you just, but you confirm yourself. Don't accept blindly. Just one thing I tell you, at an offbeat question, why you have to make it a habit? Like at this age, even I do perform surgeries, at least it is not my duty, but it is my duty. To just observe with the assistant, I am working with the sisters in the OT, I am working. I have a habit which I cultivated from 1980. So, needle sutures, I am the main surgeon. I have taken 3 sutures with needle, that is atraumatic needles. So, when I suture, I am keeping in mind, I am seeing the operation field, everything, but when the suture I use, I keep it. I keep the second, I take another suture, I keep it. Towels, mops, if, kota dili, duto. They write on the board, number of instruments, number of the things, especially small instruments, small mops. Or your assistant, you confirm with the assistant, the count is there. So anything you do, you have to think it in that term. Now you are having modern gadgets. you are having bronchoscopy. Bronchoscopy. At least up to this level, you can, the anesthetist, I'm just crossing over borders. Okay. Now, with the laryngoscope, they do, then they put the tube for anesthesia. Endotracheal tube. Endotracheal tube. Now, in tracheostomy is a procedure. You make a hole over here, you this thing, and then put in the tube. Another thing is that a quick procedure without any obstructive injury. So, endotracheal tube intubation in the emergencies. If you get a chance, you practice. So, you have to know the anatomy of the trachea. And now the trachea contains 16 to 20 C-shaped cartilage. The gap of C-shaped cartilage is bridged by fibroelastic tissue, trachealis muscle, smooth muscle. With advancing age, hyaline cartilage may get calcified. Hyaline cartilage, it consists of chondrocytes lying in lacuna, surrounded by homogeneous matrix and perichondrium, outer fibrous and inner cellular layer. Adventitia, it is a fibroelastic tissue layer that contains blood vessels and nerves. Okay. Now, the nerves and all come on the outer side. So, now see layers of the trachea, the mucosa, submucosa, cartilage or muscle layer, adventitia, these are the adventitia, outer. See the blood vessels, these are the blood vessels. And pseudostratified columnar epithelium, this is the pseudostratified columnar epithelium. And this is seromucous gland, and this is the lumen of the trachea. Now, this is the picture. See adventitia, hyaline cartilage and perichondrium, submucous tracheal glands, and lamina propria, mucus, pseudostratified ciliated columnar epithelium, goblet cells, these are the goblet cells, this is the cilia, pseudostratified. See the nucleus of the cells, see the stratification. It is not, it's all one after the other. See, this is the trachealis muscle. And see, the elastic membrane, not distinguished in H&E stains, separates lamina propria and submucosa. See, then you elastic membrane. If you are answering this, after viewing the slides, after the slideshow, now you write elastic membrane. You don't write. Even if you write, then you have to mention that H&E stain does not depict elastic fibers. It has special stain. Now, histology of trachea. Now, see, mucous membrane. Now, mucosa, below it. ঠিক আছে? তারপরে this is the hyaline cartilage. This is adventitia with blood vessels. Now, bronchial tree. এবার চল, ধরো. We have two slides. 2 slides of trachea, দুটো মাইক্রোস্কোপে থাকবে, 5 জন 5 জন করে ভিউ করো, চলে যাও। ঠিক আছে, দাঁড়াও আমি এই ছবিটা দিয়ে দিই, আগের ছবিটা। See, this picture you have it. Netflix দেখেছিলে? নেটফ্লিক্স দেখেছো? হ্যাঁ, অ্যামাজন প্রাইমে নেটফ্লিক্স দেখেছো? ঘুমোচ্ছ? এও ঘুমোচ্ছে না। এই ঘুমগুলো কি জানিস তো, এখন আমারও প্রেসক্রিপশন লিখতে লিখতে ভোর 4টায় উঠি, 5টায় উঠি, হ্যাঁ, তাতে আমি প্রেসক্রিপশন লিখতে লিখতে তখন কি করি, এমনি করে আমি জাস্ট খুব ভাবছি, হ্যাঁ, এটা হয়, এগুলো হয়, হ্যাঁ, আমি জাস্ট সেই বাট 1.5 hours ক্লাস ও 1 hour ক্লাস, এর মধ্যে তুমি 10 মিনিট এরকম এই কুইক একটা, কি বলবো, কোথায় চলে যাচ্ছ কেউ জানে না, হ্যাঁ, ঠিক আছে। এটা মিউকোসা, এটা pseudostratified. Now see this is the cartilage. এবার এই তো না, এটাকে শুনো, এটা এই ভেতরে আছে, এটা মাসল, এর ভেতরে লাইনিংটা, এটা কার্টিলেজটা, এটা মিউকাসা, তারপর সাবমিউকোসা, ঠিক আছে। এবার এর মধ্যে pseudostratified ciliated columnar epithelium, মিউকাস আছে নাই, সেরাস আছে নাই, কারণ মিউকাস আর সেরাস দুটো মানে ফ্লুইড। না, পেরিকন্ড্রিয়াম মানে কার্টিলেজের এটা পেরিকন্ড্রিয়াম, ওকে। নাও সেল নেস্ট, এটা কার্টিলেজিনাস সেলস, এই যে এগুলো, আর ইন বিটুইন দিস লেয়ার, এটা যদি মিউকাস লেয়ার হয়, এটা সাবমিউকাস লেয়ার হয়, তাহলে এখানে গ্ল্যান্ড গুলো আছে। এই তো 3টে জিনিস, আর এটা কার্টিলেজে আছে, দেখ, সব পাবি, হ্যাঁ, দুটো করে ইয়ে আছে, এই দেখ, এখানে ট্রেকিয়ালিস মাসলও চলে এসছে, এই দেখ, দেখ ব্রাউন রঙের যেটা আছে ট্রেকিয়ালিস মাসল, ঠিক আছে, দেখ, এগুলো ব্লাড ভেসেলস, এই যে ব্রাউনের মতো আছে না, আর ওখানে দেখবি এইদিকে যে টিপ কার্টিলেজ আসছে, এখানে দেখবি এই কার্টিলেজের এই টিপটা, ওটাকে যদি পোস্ট করে দিবি, এটা এটা ডিস্টর্টেড হয়ে আছে। ভেসেলস এটা দেখ, এটা একবারে সি শেপের নেই, হ্যাঁ সি শেপের আছে, কিন্তু এটা কি হয়েছে, এটা যেন পুশড আপ হয়ে গেছে এই দিকটা, বুঝতে? আর দেখবি এগুলো এগুলো মাসল স্প্যান্ডেলের মতো আছে, এটা এটা যেখানে ফোকাস করেছে সেটা আমি আমি তোকে দেখাই, দেখ এইটা এই একটু মোটা মতো লাগছে, এখানে আছে এই সি এর এনটা, এখানে দেখ সরু মতো হয়ে আছে, দেখো, আর ওগুলো ভেসেলস। দেখো এটা যেমন আমরা সি হিসেবে রাখছি, এতে তুই ভালো পাবি না, তবু দেখে রাখ, যা করবি, অ্যাপেল ফোন ফোন যায় না, এই এই যে সিটা যেমন এইভাবে আমরা সি লিখি, এখানে যে ট্রেকিয়ালিস মাসল গুলো আছে, এটা দেখবে এইরকম হয়ে, এটা আসলে যখন সেকশন কাটছে তখন একটা ডিস্টরশন হয়ে গেছে। ডিস্টরশন বলতে এমনি কিন্তু খুব ভালো মানে ছবিটা আছে, হ্যাঁ, কিন্তু এই সি এই যে সি শেপড, এটা মাসলে, হ্যাঁ এটা দেখো একটু এই রকম হয়ে আছে, হ্যাঁ, and the cartilage you will identify by the cells, cartilaginous cells, and the mucous layer ছেড়ে গেছে, হ্যাঁ, তা তুমি এই মেন আইডেন্টিফিকেশন দিস ইজ ট্রেকিয়া, তুমি ট্রেকিয়াল কার্টিলেজটা দেখো, কন্ড্রোসাইটস গুলো দেখো, and that C shaped you just ফিক্স থাকবে, ওরা একটা ফিক্স থাকলো, তুমি তুমি ফাইন অ্যাডজাস্টমেন্ট করবে, এটা নাড়াচাড়া করবে না, পরীক্ষার টাইম পাবে না, তাহলে তুমি দেখতে পাচ্ছ না, তোমার তারপরে কান গরম হয়ে যাবে, হ্যাঁ, তখন সিঙ্ক করতে লাগবে, সিঙ্ক করতে লাগবে মানে ইউ উইল সিঙ্ক। সো ইউ মানে যেটা মেন আইডেন্টিফিকেশন পয়েন্ট, দ্য কার্টিলেজ সেলস, এবং ওখানে আর মাসেপেট কই এ কই নেই। If you a block, if you take 100 section, দেখা যাবে 1 or 2 sections will be in perfect, then too a good processing for the good fixation, মানে tissue this thing the when immediately taken from the body, that will give one type of feature. Another will be, if you more you delay, then the cells, the total the anatomy gets distorted because of your it is not being preserved immediately. Then in the operation theater, what happens? We cut it, থাকলো সকাল 7টায় অপারেশন হয়েছে, সেই এটা সেটা তো বায়োপসি দিচ্ছে বেলা 12টায়। Biopsy means the whole term, the processing of the tissue up to the microscopy. You're taking the tissue, that process and all. Now, if so, one thing is that at a technical distortion, and another thing is that the tissue was not preserved immediately after excision. Am I clear? But these are okay. But what I want to say now, the block making and the fixation, your 10 pages you write up is there in the histology book. You just see it. Next, I will January, thorax hoye jak, I will just one day I will half an hour I will speak on how it is done. Okay. Now you have to take the tissue, you have to put it gently in the wax, and then that gets into a mold, wax mold, the liquid paraffin, and you put it. Then the technique, you need not know so much, but you have to know bit. And now that placing of the tissue, ধরো একটা cartilage নিলে তুমি চট করে warm paraffin থেকে you put it in there and then put paraffin wax. Now in that process, that placing might not be, it might be like this. সিটাকে তো এইভাবে রাখার কথা, like this. But what placement on the block, you did it like this. Even now when I take a section, then it comes like this. Like this. That is what you are viewing. That's why you are thinking ki holo ekhane holo na. Now you any tissue you are viewing, you see, you take one keystone, one say the end of one cartilage, end of the thyroid cartilage. Now tracheal cartilage, sorry. Now the C is like this. So you see this end and view, and you move, scroll, and see the total, see the other end. Then your perception goes, and the round, this thing with brown small individual RBCs clumped, that is the blood vessels. And if you go to the end of the trachea, you will see the muscle, trachealis muscle, in spindle form. হলো দেখা হলো, দেখে নাও, ছবি দেখবেন, ছবি দেখো, আগে দেখো, বই দেখো, ছবি আঁকো, চলো কজন? না না, এইভাবে তো ট্রাকিয়ালিস মাসলটা থাকে না তোর, তো এটা, হ্যাঁ এটা এরকম, এবার এইটা হচ্ছে তোর ট্রাকিয়ালিস মাসল। এখানে কি হয়েছে, এখানে এই কার্টেজ যখন মানে ব্লক তৈরি করেছে, তখন এইভাবে শেপটা আছে। ইউ টেক ইউ জাস্ট স্ক্রোল লাইক দিস এন্ড লাইক দিস, লাইক দিস, স্টেজ মাইক্রো, এটা স্টেজটাকে তুই ইউ গো অ্যান্ড সি লাইক দিস, দেন ইউ উইল সি this end and this end, the C shape it. Okay, now these are the muscle spindles. তারপরে এর মধ্যে সব মিউকোসা একটু সরে গেছে। It is not, what you see in the diagram picture, that is it is everything is layer by layer coming. So you don't draw like this. এটা দেখতে ভালো লাগছে, হ্যাঁ, কিন্তু it does not have any meaning. এখানে হঠাৎ করে ট্রাকিয়ালিস মাসল চলে এলো, আর এটা হচ্ছে তোর কার্টিলেজটা চলে এলো, তা তো নয়। এবার এটা কি হচ্ছে, এখানে আমিও প্রথমে একটু ব্লাড ভেসেলস গুলো, the red RBCs are there, tubular structures, now at different diameters. Now when you view this thing, you see the cartilage is like this, এরকম আছে, এখান থেকে তো স্পিন্ডল cells are. In between this you have to mucosa, submucosa, and দেখো, ঠিক আছে, এই দেখো 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 দেখো, এই কাট, এটা কি হয়েছে, হ্যাঁ, এটা ধরো মানে what we saw in the slideshow and what we saw are seeing in the textbook, it is like this. It is a muscle. Okay. Now, what this slide, you now you see muscles, spindle, microscopic spindle shaped cells. Spindle shaped cells. এখানে বাদ বাকি mucosa, submucosa. Okay. Now you see, you take this stage. When you are not in the exams, don't touch. Only you have to fine adjustment on this thing. Now you see, if you scroll, now you see this part. Upper end, this side. You view this, and then again, if you like this, you go. Now I'll try to. ঠিক আছে, এটাতেই হোক। Now see what has happened when the processing in the block. This, when the tissue was kept in the mold and liquid paraffin, and that was placed. That placement, it was not like this. If placement the technician, that he put it in the block is nice, staining is nice, everything is okay. Now you get the intact, like the microscopic this thing, your pictures in some very good atlas, D fires and all this type of Ham's histology. Now they have very good technicians and very good machineries. Okay. Now histology will depend on the block making and tissue taking for biopsy. Biopsy means the whole process of taking the tissue up to making the slide. আমাদের এখন চলতি ভাষায় হয়ে গেছে বায়োপসি নিয়ে নিলাম, but it has some steps. Now প্রথম হচ্ছে যে the quicker you take a tissue for histology and preserve it in some fixatives, formalin, okay, now alcohol. Now one thing is that even see that is I mean, India, I don't know if they are by this time. Most of the big hospitals are, I think, equipped with a histopathology room. Now I'm performing a colonic carcinoma. Now there are two batches, two teams, one working on the perineum or one working in the abdominal. Okay. Now they take the or colonoscopy, they take them tissue, so immediately put it in preservative. But in your this thing, cryosection, they take it and they put it in this thing, ice, refrigerator. Now the knife is there. Now the block, they put the this thing on the here. Now they take the slides, immediately they stain it, and they'll see for malignancy or not. If it's not malignancy, then how much? Now they plan immediately. Should I part of the disease portion? I remove colon, anastomose. Then you do a defunctioning colostomy. একটা আলাদা colostomy করে সেখানে তোমার এখানে colostomy bag লাগিয়ে দিলাম। Now that will go on, and by the time that the portion that is section was taken off, they get united. Then after 10 days or 20 days, the colostomy closure is done, whose bowel is passing, so colostomy closure is done and put in. Now this is the cryo sections will be of your depending on the condition of the patient, according to the result of the histopathology, they will plan for the operation. Okay. Now in this slide, it is bit distorted, but it is a beautiful slide depicting the cartilaginous cells and the mucosa, submucosa, and the glands are there also. Please view, please view, please view. একবার করে চক্ষু মিলিয়ে দেখিয়ে নাও। দেখো প্রথম প্রেম যখন করবে না তখন বা করা আছে, তার তো ওই এক দেখাতেই তোমার শুভদৃষ্টি হয়ে গেছে। তারপরে এখন ফটোগ্রাফাররা অনেক রকম কায়দা করছে। না প্রি ওয়েডিং ফটোগ্রাফিতে প্রেম হচ্ছে না শুভদৃষ্টিতে প্রেম হচ্ছে? এই আনসারটা আমাকে পাঠা। ঠিক আছে, চলো, এভরিথিং ইজ অ্যাভেলেবল। এটা যন্ত্রটা দারুণ ভালো যন্ত্র, দারুণ ভালো যন্ত্র, কিন্তু সেটাকে মিসইউজ করলেই মুশকিল। তাহলে এই স্লাইডটা বোঝাতে পারলাম? বুঝলি না? এই তো বল, আমি ঘুমোতে যাচ্ছি। বেশ, দেখো, this section is from the same block, that and this. Okay, same block, মানে same tissue. Okay, same animal. Now you are saying আমাদের এরকম কি দেখছি, তোমার দেখার কথা এইভাবে, এটা ট্রেকিয়ালিস মাসল। এবার তোমরা কি দেখছো? এই রকম দেখছো।